Today we'll be talking about this new kid on the block that is called Synergy from Johnson and Johnson. I have no financial interests, and today we'll be talking about this novel IUL that combines the qualities of Symphony, EDOF, and the trifocal lenses from Johnson and Johnson. Hi, this is Dr. Simanchal Goyal, and today we'll be talking about Synergy IUL. I'll be first demonstrating you 5 pictographs, and later on I'll be showing you a real case implanting a Synergy. It was a VVIP patient and I am going to operate the case for you. From the first pictograph and the second pictograph, you're going to see extraordinary contrast when Synergy was compared with Acrisof IQ Panoptix. As you can see, the contrast sensitivity was much better than the Acrisof Panoptix in day as well as night. Several factors responsible for this. This IOL offers widest range of continuous vision, best near vision N6, superior image contrast in low light conditions especially, higher satisfaction and reduced need for glasses. 97% of the patients reported no need of glasses. This IOL is powered by IntelliLight technology that allows the UV light to go through and blocks the violet spectrum for enhanced night vision. As you can see clearly in these pictographs, gives broad range of vision and eliminates the visual gaps, continues to deliver superior performance in low light conditions, and violet filtering technology demonstrates reduction in halo intensity, especially for night driving activities and the activities in which there are chances of halos and glare. So I'll be operating this renal transplant patient which was on high dose steroids, and for high dose steroids the patient developed posterior subcapsular cataract in both the eyes. He came to me for help, and as the patient was around 37 years of age, I had planned a Synergy IUL. Some of the colleagues of mine are really scared about why to implant this IUL in people who are going to be prospective drivers in the night and who have chances of getting halos. Trust me, I have implanted around 80 or 90 Synergies by now, and there is absolutely no worry that you should have while implanting Synergy. As this patient was professionally active and at 37 years of age, I wanted a really safe IUL, and because the patients these days, around 70 or 80% of the patients, if you question them in the OPD, they are going to tell you that they are avid users of digital devices, phones, laptops, iPads, and they are really good readers. So we need to target an IUL that meets the prospective patient needs. And as you can see in this video, there are some beautiful hydrodelineation and hydrodissecting waves that I have made in this patient. You can appreciate a really nice glow because the lens was relatively clear despite some small geographic posterior subcapsular cataract. I have made this bleeding side port consciously because it helps in better healing of the wound, and it's really soft. I don't even need to put some vaco energy, and just from the vacuum the cataract comes out. As you can see carefully, just look at the size of my rexis because it's Synergy is an amalgam of EDOF and trifocal technology. I need to keep the rexis small so that there is perfect centration of the IOL in long term. One pearl of wisdom that I am going to share with you is in the end of the case. I leave my signature on the IOL. For patient benefit, I'll be disclosing that move at the end when I'll be making it. And just like that, I am going to switch to I&A. I'm a fan of bimanual, not a user of coaxial irrigation aspiration. This IUL is beautiful. I have implanted in young patients, I have implanted it in housewives, I have implanted it in the eyes of a lawyer, a politician, and not a single patient came to me with significant glares or halos. A lady, yes, reported to me that she is having some glares and halos, especially when she is sitting beside her husband in the night, but they're not troublesome. If you're just guessing what I'm doing right now, I'm just polishing the undersurface of the anterior capsule to avoid any capsular phimosis in the long run, and decreases the chances of PCO formation. Studies tell you otherwise, but I have noticed in my experience that it really reduces the chances of PCO. And here you go, I'm going to show you the Synergy IOL. I'll be putting it in the cartridge. If you're having difficulty in putting the IOL, you can adopt my method. This is J&J. I guess it was 20 diopters. There's no near ad needed to be sent to the Johnson & Johnson. They have these algorithms that calculate the near ad for each diopters of Johnson & Johnson, and just like that you fold the leading haptic and push the trailing haptic as it folds itself on the optic, and put it in the Johnson & Johnson Platinum injector. And here you go, beautifully empty bag, clean, a good red reflex, that of a young patient. And yes, there you go. The video, for your kind information, is sped up at 1.5x. The total operative time of this case was around 10 minutes, which comes down to 6 minutes in this video. And just like that, the IOL is in the bag, and I'll be taking out the visco, aiming for a very good centration of the IOL because I want no complaints. I'm an OCPD. I have obsessive compulsive personality disorder when it comes to my surgeries because I want everything to be perfect in my surgeries. It's a good thing to have in your personality when you are a surgeon, especially an ocular surgeon. I just lifted up the optic and expressed out all the visco that was trapped between the posterior capsule and the optic. Washing, and yes, hydrating the side ports, hydrating the main port, putting some intracameral Vigamox, hydrating the roof of the main port. And let's call it a day. It was a beautiful case featuring Synergy IOL. All of you who are having troubles to believe the efficacy of this IOL, trust me on this. Trust me, this IOL won't disappoint you. You all must implant these IOLs in your patients without a hurry. And at the end of the case, I love to tilt the IOL slightly nasally because the pupillary center is in a little nasal orientation in a normal anatomical human eye. So this is the pearl of wisdom I would like to give you. And that's all. I hope you like my videos, and I'll leave you with this pictogram that shows how easy it is to see objects and signs, see a menu, and see steps or curbs with Synergy from these percentages in 90s. Thank you and have a great day ahead. Like, share, and subscribe my channel.